Bismillah ar-Rahman ar-Rahim. Thank you very much. I'm really happy and honored to be part of this session. I would like to thank the Saudi Cultural Mission in Washington for giving me this opportunity. And our session today, I know it's quite late in the day, or almost evening now. The session will be more into nursing and physiotherapy, and a little bit about applied medical sciences. So we will start by inviting our first speaker today, who is Dr. Rafat Qahush. Dr. Rafat is the director or the president of California School of Health Sciences and California Career Institute, and he's going to be talking to you about nursing and all about what are the programs available and how to work as a nurse in the United States. Thank you, Doctor, please.
Assalamu alaikum. My name is Rafat Qahush. I'm an RN. Graduated from University of Jordan in 1989. I immigrated to the United States in 1992, where I finished my master's degree from University of California, Los Angeles, and I did my PhD in nursing from San Francisco. I have been in nursing education and placing nursing students in higher education for the last 15 years. So I have enough experience to explain to you how you can get to and admitted to the universities. Below my name is my email. Feel free to write it down. I have some packages, upstairs in your site or here, so you can borrow these packages. It has all the explanation. The purpose of this presentation is to provide you with information, mainly to help you to gain knowledge and mainly to be able to understand the process of registering or getting accepted or admitted at programs in the United States. From our experience, we find that many international students, they lack the knowledge or they don't understand the system. That's why they struggle when they try to apply. Again, we have different degrees in the United States. Let me explain it to you. If you have only high school diploma from the Saudi Arabia here, you can start with associate degree in nursing, which is 2 years program. And then you can continue toward bachelor degree. If you have associate degree or what you call diploma, then you can continue from diploma to BSN. Now, to continue from diploma to BSN, it is a little bit challenging for you. Usually, the US system will not accept the degree you have, and you might start from the beginning. Now, to be able to continue without repeating the courses, the best way is to go and apply for the RN exam. So if you have two years or 3 years nursing, the first step to do is to apply for the Board of Nursing. You are qualified as associate degree to apply for RN exam. If you are able to pass the exam, then you can continue from RN to BSN. It takes you only 2 years. So if you need to bridge, the best way to bridge is to pass the board exam. And then you can continue. Again, for we discuss, if you have 2 years or 3 years nursing, start with RN exam to pass, or you might have to transfer your credit, and they may count a few of them only. Now, Bachelor of Science, it is a 4 years program. So if you don't want to go for 2 years program, you can go for 4-year program. In the US, it is very difficult to go for 4-year programs. It is very competitive. There is big waiting list. So it take you time to be able to get in. You have to have a high score. You have to have a lot of prerequisites to be able to be admitted to the BS degree. Again, you have to prepare for English and admission test. So all BS degree, they have what we call admission test. So you have to be prepared for an admission test to be able to be admitted to the university. Master degree in nursing. We have many masters in nursing. The most common are master in what we call the clinical nurse specialist. And we have many. For example, we have critical care, we have pediatric, psychiatric, women health. The other specialty is nurse practitioner. And you can be family nurse practitioner, midwife, again, psychiatry, pediatric. The difference between a clinical nurse specialist and nurse practitioner, clinical nurse specialist usually is a consultant in nursing, educator, and researcher. If you go for practitioner, you will be able to provide primary health care, or you will be able to assist the patient, prescribe, or furnish some medication. So it is kind of physician assistant. I'm not sure if it is approved in the Saudi Arabia here, but today in my visit to some hospitals, they said they are looking for this specialty. Or you can go for nursing educator and nursing management. Most of the Saudi students for master degree, they try to go shortcut. The meaning of shortcut, let me go for the easy program. The easy program for you is the nurse educator and nurse management, because at many schools, they will not require the NCLEX or the RN board exam. If you are looking for a clinical course, like critical care, psych, pediatric, maternity, women health, you have to have the RN exam before you enter the university. Community health nursing or public health nursing, also another option for you. The last degree, what we call the Doctor of Nursing, PhD. Again, if you have master degree from Saudi or other countries, some universities might waive the RN requirement. So I knew few Saudi students who went to their PhD and they never sat for the RN exam. Again, other requirement could be GRE and TOEFL. Again, if you are looking to go for master degree from here, it is advised to start the process as early as possible. Okay, I have 2 minutes to go. Again, you can get conditional approval from some universities. Conditional approval doesn't mean that you are admitted. Conditional approval for most universities is to get you to their English program and to make money out of you. So conditional approval is not guarantee for nobody. Conditional approval means if you meet the criteria of admission, you will be admitted, which means still you have to do the RN, still you have to do the English. So it is better to apply for 5, 6 universities at the same time, not to stuck with one of them. Again, we advise all Saudi students to apply for Board of New Mexico, because if you apply for Board of New Mexico, it will be easier for you to get accepted, and it will be accepted in 24 other states. We hope you pass the first time you apply, or you sit for the exam, you can pass from the first time. If you fail, you can repeat the test every 45 days. Again, try to be in contact with your advisor or with your SACM advisor to be able to achieve your goals. Sorry for the short time here, but we take care of many Saudi students. So if you want to join our institution, we can help you to apply for the Board of Nursing. We can help you to get your Social Security to apply for the board. We can prepare you for the NCLEX and the English preparation. We have excellent facility, excellent training, and we have very good outcome. Passing rate is, above the average. Again, we can prepare you for TOEFL, IELTS. We have nice weather, and we can, take care of you. Sorry for the short time. I have to finish the speech in 2 minutes, or I'm done. So if you have any questions, I will be in SACIM booth. You can come back to SACIM booth in a few minutes. I'll be there. I can answer your questions, and I can give you some brochures. Thank you.
Unfortunately, due to the time that passed in the last previous session, and there is another session which is supposed to start, I think we have to stop. So what we will do for the rest of this session, we will go to the second booth, and we will invite our guests to be there for any questions, or whoever is interested to learn more about nursing programs or physiotherapy or allied health sciences. We will go there, and we apologize to our guests because of what happened in change in the program and the inconvenience. Sorry again, we'll meet you there. Thank you.